So this is Sean Ascom, Chairman of the Public Safety Subcommittee, and I would ask that we try to do this as orderly as possible, guys. So with all possible, everything go through me this morning. And remember, this is on live TV, so be very thoughtful and to the point with your questions, and we'll go on with roll call from there. Is there a Board of Ed rep on the phone?
Yeah, it's Neil Sullivan from Director of Personnel for the Simsbury Public Schools.
Thanks, Neil. Ambulance rep?
Yes, Karen Stewart, Executive Director, Simsbury Volunteer Ambulance.
Excellent. Our emergency management team?
Yeah, Kevin Kowalski, Emergency Management Director.
Do we have Mike as well?
Mike, Assistant Emergency Manager.
There you go, Mike. Fire?
Barry.
Jim Baldus, Fire Chief.
Gary Wilcox, President, Fire District.
All right, and then police?
Nick Bolter, Chief.
There we go. And then I heard Tom Roy from Public Works, right?
Tom Roy here.
Okay, and then Farmington Valley Health District?
Jennifer Curtanis.
Star of the show. There we go. Thank you both. Social Services?
Kristen Formanak, Director of Social Services.
And then our additional partners, I believe Sarah's dialing in. Sarah, you out there?
Sarah Nielsen, Simsbury Main Street Partnership.
Thanks, Sarah. And is my peer, Chris Peterson, on the line?
Hey guys, I'm here. Good morning, it's Chris.
Okay. And anyone else?
Nancy Sheets from Farmington Valley VNA.
Sorry, Nancy. Thank you.
Good morning, Mark Massaro from Eversource.
Hey, Mark.
Good morning.
You get to stay on mute and enjoy not being on the hot seat for this disaster, huh?
I'll take what I can get.
Sorry, trying to lighten it up a little bit for you. Anyone else? All right. There was some confusion with the invite. I think some of us took an update from members of the committee and others didn't, so there might have been a cancellation or not. So thanks for everybody being here, because obviously the meeting's not canceled. Maria, we are still having email issues, so some of us on some devices got the invite and the agenda. Let us know if you did not, and we'll try to get it out to you. We're going to, obviously there's no public audience at this. There was an opportunity to send out the minutes. Is there any objections to the minutes from the prior meetings? Excellent. All right, we'll go right to it. And I'm going to skip around a bit, but let's start off with the topic of the hour, Farmington Valley Health District, please.
Okay. We are seeing a doubling of confirmed, which I mean, and what I mean by confirmed cases are lab confirmed cases every single day. Testing for this virus is not easy, as we know. The state lab capacity is focused on those that are most critically ill, hospitalized patients, so that they can protect the healthcare workforce. They have loosened up that testing a little bit, and we know that some private labs are gearing up quite rapidly to provide more testing available to the public, not for the well, but for those that have a doctor's note and have been screened and determined to be appropriate for testing. That testing availability is still relatively limited in the Hartford County area, although that changes every single day. All of that to say that the number of confirmed lab cases likely grossly underestimates the burden of this disease in our communities. Matt Carter, the state epidemiologist, has indicated on press conferences that for every one lab confirmed case that we have, we can estimate that there is 100 or more cases that just have not been confirmed through laboratory. As you know, the governor practically every day is issuing a new declaration regarding closings, etc., all in an effort to prohibit or encourage social distancing. So restaurants are able to remain open with no eat-in capacity, so takeout only. Bars are closed as well. Most of our businesses have made arrangements for distance working, remote working, etc. For those that have not, they're encouraged to do social distancing within their workplace. We are working very closely with daycare providers who have chosen to remain open. Most of these have reduced their census by about 50%, but are providing childcare for critical infrastructure, first responders, healthcare providers, etc. We have provided them with specific guidance on how they're doing temperature checks of kids as they come in. Where they can, they are separating groups of kids, keeping those groups together with a single or dedicated teachers. We are fielding calls all the time from them regarding what to do with the kid with a sniffly nose. They do have good policies and procedures in place for getting sick kids isolated and out the door as quickly as they can. So we're going to continue to support them in their efforts as this moves forward. One of the other populations that we are exceedingly concerned about is our aging population. I think 2 weeks ago, we worked with all of the senior centers. Kristen was a key part of that discussion. As you know, all senior center non-essential activities were ceased about a week and a half ago. The other area of concern for us that sort of falls through the cracks are these independent living facilities. So we have also provided them. Most of them have a board of directors that's run by volunteers or residents within the facility. These are not, professional healthcare providers, that sort of thing. We have provided specific guidance to them, both for their facilities and their residents, and we are following up with phone calls to all of them, just asking if they have any questions or what they need to do to try and keep their population safe. As you know, may have heard, there was a death in an elderly person who was a resident of a senior living facility in Ridgefield, announced this morning. And that's one of our greatest concerns, repeating another kind of Seattle, Washington situation, an enclosed senior housing development. It can travel through that population quickly with pretty significant and negative outcomes. So I think we are also fielding a lot of questions from our municipal departments who are continuing to remain open but have questions about potentially, sick workers or people that may have been exposed, et cetera. So we're continuing. We monitor confirmed cases in the Farmington Valley. To date, as of last night at 7 o'clock, we have no lab confirmed cases. We check that through Connecticut electronic disease surveillance system every day. For as long as we can manage it, any confirmed lab case or suspect case, and there's a definition now as of last night for that, we will isolate those individuals, provide them with guidance on home isolation as long as they're healthy enough to stay home. We will do contact tracing for those known cases and put them in, home quarantine with follow-up of symptoms and tracking. We'll do that for as long as we can manage it. What's been very helpful is the fact that we do have social distancing in place, so very few people are actually going to work, going to places where they can potentially expose others. So I think with that, I'll stop because I imagine people will have more questions, but that's kind of a quick overview of where we are.
All right, so
Thank you. That's obviously a very robust and thoughtful update. We appreciate it, and I'm sure you're running on probably 8 minutes of sleep over the last week. So thank you for being here as well. Maria, you and Kevin want to start off with on the top of the emergency management. Any questions, things to add, thoughts there from the town side before we go down the list?
Yeah, sure. Thanks, Sean. I'll just do a high-level overview of where we're at here at the town. Eric and I issued an emergency declaration a few days back now. Really, we wanted to be prepared so that if I needed to take, any necessary actions to mitigate the effects of what's occurring, that I would have the ability and the authority to do that. So that is now in place. I'm sure Kevin or Chief Baldus will speak to it, but the fire district has taken a similar step. We are encouraging our residents to utilize online services as much as possible. We recently, as of this morning, our buildings are officially closed to the public. We will, on a case-by-case basis, at staff's discretion, meet with individuals if an urgent need arises. We are providing services still over the phone, by email. Again, we have a lot of online services that people can take advantage of. We've also created a brochure that highlights our most commonly used online services, and we've been trying to circulate that and publicize that. We do have an incredibly dedicated group of staff that is still here, still providing essential services. Let's see, what other quick highlights can I give folks? We've established a secure drop box at Town Hall, so people can drop off various forms, applications that they need processed. We will be checking that multiple times a day. Eno Memorial Hall, where social services is located, has a similar box where people can drop off donations. One of the questions we've been hearing a lot in the community, which is just wonderful and incredibly generous, is how can we help? How can we help people in the community who are facing financial hardship? How can we help folks who are experiencing food insecurity at the moment? So what social services has said that the most needed items right now are non-perishable goods, toiletries, gift cards to grocery stores, gift cards to gas stations, and gift cards to laundromats. So we are taking those donations at this time from people. And I would say that those are probably some of the key points. As we mentioned earlier, this meeting is closed to the public. We have canceled all non-essential town meetings at this time. So essentially all of our advisory committees are not meeting. Our regulatory bodies are continuing to meet for essential business if there is something urgent that needs to be taken care of. And as part of the governor's executive order, we're just ensuring that those meetings are being recorded live. And residents who might want to submit public comment for those meetings that are closed to the public can do so by getting in touch with our town clerk's office. They can email their public comment to ebutler@simsbury-ct.gov. So there is still a way for people to participate in the meetings of the regulatory bodies, as well as watching them live, or they can later watch them online through SCTV.
Thank you, Maria. So folks have questions before we move on. I just want to make sure we get everything out on the table that folks are concerned about. If we could, I know there's some business questions, and I do want to get to those, but if we could start with the people and the process and the emergency declaration questions first.
Sean, hey, it's Chris. Good morning. Again, Maria, thanks for that update. Just you touched upon the community reaching out and looking for ways to help, and you gave that thoughtful list of items. Could you just remind folks again, restate where they can be dropped off, considering, and how they should be dropped off, considering these new limitations on access?
Sure. So we're taking donations at Eno Memorial Hall. We have a secure drop box where people can leave gift cards and monetary donations. There will also be a cart outside of Eno if people want to drop off non-perishable goods, toiletries. What we're encouraging folks to do is to call the main department number to social services and let someone know that they are planning to make a drop. And then staff who are working inside after the drop has been made will come out and they will pick up the donations. And so again, folks wanting to make donations, we're just encouraging them to reach out to our social services department by phone and let them know that they're planning to make a donation.
Thank you. I do have a question for Jennifer on, there's a lot of misinformation, confusing information, et cetera, out there. Just the official guidance of where we should be sending folks for information and up-to-date information?
Sure. So the Centers for Disease Control website is excellent and organized quite nicely for the general public, healthcare providers, etc. The Connecticut Department of Public Health website also is a good resource. And then the Farmington Valley Health District is trying to keep our website current with links for people who have specific questions based on whether they're a resident interested or concerned about X, Y, and Z. So those three sources are probably the best. For more and specific questions, I mean, we are dealing with daycares as an example or town meetings. We're fielding a lot of calls in our office as well.
Yeah, and Sean, this is Maria.
And Beth, I was just going to ask, the best way to reach out or when it's appropriate to your folks is probably through email or phone call or which is preferred at this point?
Our office number is 860-352-2333. And then we have an info@fehd.org that people can use as well to email.
Okay, thank you. And not looking to inundate you guys, but just want to make sure that if folks are seeking information, they're getting the right information. Because unfortunately, and as we all know in these times, Facebook and other places have become the essential oils and home remedies and everything else that's going on. And we should be directing folks to the right source of information.
Yes, thank you.
Yeah, Sean, this is Maria. Thank you for that. I'd also just encourage folks in regards to, town services, programs, facilities, other helpful information. Our homepage, we are also maintaining pretty regularly. There's a link there. You click and you'll get up-to-date information. We'd also like to encourage residents who haven't signed up for what's called our news and announcements. They can do that through our homepage. We're pushing information out that way. And the town has an official Facebook account as well as an official Twitter account. So we're trying to update information there as well. So we have a number of different mediums for folks to get official information and would encourage people to sign up for those.
Absolutely. Thank you, Maria.
Thank you.
Additional questions from the group on the people and the process and what's happening?
Sean, this is Kevin Kowalski. I just want to give you an update on the emergency management.
Yes, sir. Sorry, didn't forget you, Kevin. Go ahead.
I just want to let you know that we have been on a web-based emergency operations center operating. Mike is maintaining that on a state level, updating it on a daily basis at least. And as things change, it's kind of flat right now. We just get data back and forth from the Emergency Management Central Office in Hartford, and we put that information out as necessary. The priority list that we have established under the current emergency action plan basically is, first of all, protect all the first responders, make sure they have adequate protection. I know that we're on searches for protective equipment for all these folks, not necessarily for right now, but if it should get worse, which it probably would, and we want to make sure our folks are protected. So we're constant search for that product, and thanks to Jim Baldus, he's been searching around for other product, and other personnel have also here. The senior population's the next one. We've been monitoring senior population along with assisting with Kristen. Whatever needs she has, the Ladies Auxiliary from the fire company has established a delivery process if needed for food and pharmacy in the event that the elderly don't want to get out and get food and their prescriptions. They'll provide a pickup service for that. The third item is the businesses, basically to ensure that we can assist in any way to maintain their level of service and maintain their business. That's an important factor in this particular item because, quite frankly, after the fact, if we have only 50% of our businesses left, we've lost. So what we're trying to do is trying to get information out when we get it. For instance, we sent out yesterday the SBA loan program that's out now. And I think Sarah and the chamber has picked that up and put it out to their members, I hope. The other item is we're getting things daily, and we're pushing that information out both on the website and also sending it out to the business community where we can. We will also be, we've added 6 more people to the radio station, and they'll be doing live radio work in the evening where we can, and we will have community notes on that radio station, as well as advertise for business community, including restaurants. We have no problem doing that, and we'll continue it as long as we can. So anyone that wants to give us information, you can send it to me in my email address, kkowalski@simsburyfd.org, and we will make sure that that gets out in a timely manner. And hopefully that'll assist in some businesses that are going. And that's pretty much it. But Mike, do you have anything you want to add to that?
No, I think you did a pretty good job. The only things that I have to dovetail into that is that I am in contact with state officials daily. We are having multiple conference calls, so I am keeping up on the latest information that's coming down from the state. And yesterday we had a conference call with the region, so we're keeping up on our neighbors around us. And I have been updating WebEOC. I just updated it again right now with the information that's been passed to us. And I have reached out to our 3 convalescent / elderly housing projects to let them know that we are up and running, and if they need any assistance from us or any guidance, that they have my phone number and also the number of the firehouse. And if they have any information or any status updates, they can get a hold of us and let us know what's going on.
Thank you both. I know there's a lot of work going on right now that most folks out in the community don't know, but I know this team is hard at work and getting everything set up, so I appreciate that. I did have a question, and again, not trying to be presumptive here, but other states, other communities are using the word shelter in place. I don't know if we're going to get there, but could we just have a quick update on what shelter in place might look like? Because I think the definitions are different than what folks might be used to.
Well, basically, it's just as it sounds. Just please stay home.
Right.
It's pretty clear on that end. We use the old shelter in place in hazardous material incidents. Well, this is pretty close to a hazardous material incident. Where we're telling people to please stay home, stay within your pod, your family pod, and hopefully it won't spread from family to family, and get out. We know that's going to be almost impossible, especially when you need groceries and pharmaceuticals and other items. We just want to make sure that when you go out, that it's a valued visit. In other words, you're gonna go out, get stuff, come back home, and keep it going. At this point, there hasn't been an order to do that. To my knowledge, I think New York is the only one that has that order.
San Francisco.
We'll just monitor it. And maybe Jennifer, you have more info on that.
San Francisco.
Yeah, and again, I'm not trying to get ahead of ourselves here, not suggesting we're going to put that in place, but just want to socialize what that means for folks early on.
Right. At this point, it's not happening, but you never know. It could,
I mean, again, it's changing every single day, but I think in, inner cities where you're living in much closer proximity, I think there is potentially a role for that. In communities like ours, I think we still have to go back to disease transmission. You are at greatest risk when you come in close contact with someone who is experiencing symptoms and or touch a surface after someone with symptoms has, wiped their nose, touched their mouth, and touched the surface. So I hope we don't get to the point where we have to shelter in place. I think that could create far more harm and danger potentially if people are feeling anxious that they cannot have access to food, medicine, those types of things. We have to keep in mind people should be encouraged to go outside and go for a walk. Again, with those separating distances, and if you are not experiencing symptoms, if you're not coughing and you don't have a fever, again, just we have to come back to disease transmission. And I think in those cities, again, they felt that there was a need because people were continuing to gather in tight, confined spaces, lots of people together. That's what we're trying to avoid here, I think.
No, and I appreciate that. You know, we all hear on the news different terms, and, you know, the general public, and including myself, we don't understand why one community does something different than others. But you guys, the professionals, have different protocols, as you said, for different densities, different types of living arrangements. So I appreciate that. And I will share with you, you know, visually, I've seen, not met because we're staying far away from each other, but I've seen more neighbors in the last 3 days than I've seen the 4 years I've lived in this neighborhood. So the bright spot is people are doing, I think, exactly what you just suggested, Jennifer. They're getting out, they're taking a walk, they're maintaining appropriate distance, and trying to have whatever sense of normalcy there is right now. So I think there is a bright spot in all of this.
Yeah.
All right. I know, Sarah, you have some business-related questions. I didn't want to push those down. I just wanted to talk about the people side first.
Yeah, thank you. Jennifer, my quick question first is the Farmington Valley Health District considering what Bristol did as far as more formalizing the governor's heed to close salons, spas, nail spas, things like that?
We will think about it. We've fielded a lot of questions from our salons. We've issued them specific guidance about how, if they want to remain open, they can. Walk-ins only. They need to make sure their clients are healthy. No facials. You know, doubling up on, you know, the things that they do in terms of hand washing, etc. I guess my feeling is I cannot micromanage every single small business. Where will I draw the line? Do I close Home Depots? Do I close bookstores? Do I close other businesses? I think people can go to the bookstore and get a book if they're healthy and not exhibiting symptoms. There was a push for the governor to make that declaration, and I'm not sure if he will, because the other thing is enforcement. If it's a governor's declaration, then enforcement is done by law enforcement. I do not have the staff to enforce a closure like that under these circumstances. I have to focus my staff time on, you know, tracking cases and ensuring quarantine and that sort of thing. So we've provided them with guidance. Some have chosen to close. You know, it's a day by day. We'll see if the governor issues the declaration. Do you have an opinion on it?
Well, right now, like I said, I think that I thank you for that. It is very difficult to micromanage the businesses, and many of them have moved to even stricter protocols. They already, you know, I'm reminding everyone that our small business community already follows protocols through the Farmington Valley Health District. So, you know, I'm hearing a lot of, and I'm fielding a ton of worried phone calls from people that are afraid that the health district would, you know, is going to close things. So you would not do that at this point unless it's through the governor.
That's my feeling right now. Yes.
Okay, and I understand it could change based on, you know, a very fluid situation.
Yep.
Thank you.
And I know there's been some confusion out there, Sarah, right? But the businesses in general understand we're not targeting or picking on them. It's the public health need outweighing the business need, and we need to shut certain industries down, right?
Yes, I will say that they've been very compliant. I released a list yesterday of all of the restaurants that are providing takeout, curbside pickup, or delivery at this time. So they're all complying. Only a few of my restaurants have actually chosen to close. So they do understand that. They are working within the system right now to still provide services to the public, but in a safe manner.
And we've issued guidance. And we've issued written guidance to all of the restaurants too, in terms of what we need them to do to be able to continue to offer that service in a safe way.
And we've actually been utilizing several restaurants. We went to Meadow last night, and folks are being responsible. We're one person's going in at one time and coming out, so people are taking this seriously. But it is appreciated by the restaurants. I know I talked to Sam in particular and the folks at First and Last. That anybody that does utilize their takeout is very much appreciated. So we shouldn't forget them, because as Kevin said, if we don't keep our businesses afloat as well, then we failed here too. Sarah, you have additional stuff or other folks on the business side?
Just a quick note, as in addition to the restaurants, we have many small businesses like Ava Grace and others that are moving to either online and or phone sales. So they have also agreed temporarily to close down, but they are still selling things. So we encourage the public to, again, you can still make purchases from the comfort of your home while you're not sheltering in place, while you're isolating yourself, social distancing. And then I just had a quick question for, I guess, Kristen Formanak, is we are starting to see a little uptick in Facebook posts. We own the Simsbury, Connecticut page, which has over 8,700 members. Is there, and I might have missed it, is there a way to get out what we can be doing for mental health right now? Because I think all the social distancing is putting a strain on some of the vulnerable parts of our community.
Yeah, I think we're going to see where, people's mental health is going to start to be strained because of the social isolation and the stress of the event. Unfortunately, a lot of resources are practicing the same practices that we are. And I've seen where most resources, such as therapists, are moving towards telephone or online support. They have loosened up some of the guidelines around that so that therapists can bill and still be reimbursed using the teletherapy model. We're also seeing other resources like Mobile Crisis is no longer mobile. They're only doing phone screening. So I think our concern for this issue is very valid when we see the need increase and the resources decrease. Our office, what we're planning to do over the next few days is start doing an individual outreach to all of our seniors and our social services clients just to do a warm check-in. And we're also looking at doing some Facebook Live feeds to our clients and to our seniors just to offer that support and make that contact with them. I think it's important that, as we continue through this, that as town officials, we're remaining as calm as we can, and we're getting all the information out as soon as we have it, and people are going to start to, really look to us, and they're going to keep looking to us. So I think that this is an issue that also might continue to get worse.
Agreed. Just a thought to Maria. If the town can begin or has a compilation of services that are provided or can be provided, it'd be good to be proactive before we see a mental health crisis.
Yep, we one of the things that we published yesterday as part of the blast that the buildings are closed is my office put together a pretty comprehensive list of the essential resources that people need, both grocery shopping and pharmacies, and how to access those things, in addition to answers to some of the stressors that our folks routinely would have anyway, such as energy assistance, evictions, things of that nature. So we've tried to get answers to those questions ahead of time, and we have that in our resource packet as well.
Kristen, this is Nancy Sheets. Can I add something?
Of course.
Of course.
So, just in the event, I'll just remind you guys, Kristen, because you've contacted us before, but I have a group of nursing staff that obviously have been pulled from community health, but are definitely available for those check-ins and can easily go out and make visits in the event, especially with regards to mental health. So if there are any of those people that you need backup for, or just to have somebody check in with them, they are available to do that. In addition, we also can field calls. So if at some point it gets to be that you need some nurses to do, to serve as kind of a hotline, because we're certainly getting flooded with calls just from people in the community that have health questions, which is fine. That's part of what we're here for. We also have more of that in the event that you need assistance.
That's great. That's really good to know. And I think in the next day or two, I'll probably want to have a separate conversation with you about that. But I think that's going to be a really good resource for us. I think just to share with you, we have not been getting a lot of phone calls yet. I think people are, taking the time to assess their own situations and get settled. But I think the calls will go up as we progress and now that the buildings are closed. So we'll probably see more needs soon.
If I may add one quick item, and that is that I think the reason why the phones aren't ringing off the hook is because we obviously still have power, we still have internet, we still have news, we still have, and quite frankly, the news is almost overwhelming. So people are getting most of their information, good and bad, on media circuits. So they don't call us directly for their questions. I'm sure if, and I'm not going to jinx ourselves, if we have a problem in any of those other areas, we will be tasked with 10 times what we're doing right now. So we're monitoring that, and I'm sure the needs of the community. I know we've been working, and the state's been working with Comcast and with all the internet providers out there to make sure that they're increasing the data load abilities of the lines to try to make sure that they can service the people that are both working at home, schools that are training at home, people are just using the internet for information. That's an important piece of this pie here, and we have to maintain that too. So that was just another point.
That's a great point, Kevin. Thank you.
Agreed. And people have not run out of stuff yet, so that's a good point too.
Absolutely. Okay. Before we go through the list, Kristen, was there anything else from your social services world that you wanted to update us on?
No, I just want to share that I'm very proud of my team. Monday, we packed 150 bags of shelf-stable food and toiletries, and we also secured gift cards, and on Tuesday, we distributed those to our vulnerable clients that routinely experience food insecurity. So, everyone did a really good job. Tom's crew helped support us, and I feel like we did a really good effort in getting stuff into people's hands before they weren't available.
Thank you for that. That's the little stuff that often goes unnoticed, but is critical to keeping folks calm and safe during this stuff. So thank you.
You're welcome.
Okay, education. Neil, from the school side.
Yeah. So, on the food insecurity side, I would note that we are providing breakfast and lunches, and the way that's going to work is that on from 10 to 12 on Mondays and Wednesdays. Right now, we're centralizing the operation at a Simsbury High, but it's for anybody in town with children who can come on Monday. You'll pick up your breakfast and lunch for Monday and Tuesday, and then on Wednesday, it's for Wednesday, Thursday, and Friday. So right now, obviously, like everything else, subject to change, but that's how we're operating our breakfast and lunch program. It's targeted toward families that are on free and reduced lunch, but it's not limited to those families. So we served about 50 yesterday on our first day of the operation, and we expect that number to grow. So that's on our food side of things. Obviously, we are shut down and anticipate we will be for quite a while. Our distance learning platform will be, believe it or not, up and running on Monday. So we just sent that notice out to families. Expectation is that teachers will, by 9 o'clock each day, put out tasks for kids to complete that are age appropriate, and their education will continue in that way. Our emphasis is on engaging kids in learning as opposed to a high degree of accountability or assessment or anything like that. But as we've been hard at work getting that up and running, and we'll launch on Monday. We are, in order to allow teachers to move forward with that, tomorrow we've created 2 windows of time for teachers to quickly access the building, practicing proper social distancing, come in, get what they need, and go back home. So that will happen tomorrow. And then other than that, are the only employees who are not in a work from home environment at this point are our custodians who are cleaning the buildings. Everybody else is in a work from home environment, and the only people needing to come in to work are the few nutrition services people that are dealing with that breakfast and lunch program, and a couple of there will be a need for a couple of payroll people to come in every couple of weeks. But other than that, this was by being in a virtualized environment, we actually believe, a high percentage of the functions can be fairly productive in a work from home environment. There are some exceptions to that, but, we can actually bring your desktop to your home computer pretty easily for 99% of employees. So we're going to brave new world of a work from home environment, but that's where, we basically entered that in the last couple of days.
Excellent. You can be as miserable as the rest of us working from home.
Hey, Neil, this is Tom Roy. With the food giveaway at the high school, do you need any assistance in terms of traffic management that we can provide with the highway department?
I would say right now, we had 50 takers yesterday. I know that our Director of Security, Mark Kritz, was there to help organize, and I guess I would ask you to touch base with him if he feels there's a need for some assistance from the highway department. But with the amount of traffic we had yesterday, I would say no, but I certainly think that it's probably going to grow.
Neil, hey, good morning. It's Chris Peterson. As a parent of 4 children in your school system, I just want to make sure you know that and pass along to Matt. Thank you guys for all the communications that have been going out. It's been impressive, so I appreciate that. And I know that some, obviously folks who are not engaged with the education system in town don't see all the good work and hard work that's going on. It is a new world for you folks, and your team is adapting, and I'm sure it'll be successful. It's also impressive to note that you guys turned around the distance learning quicker than I believe you expected to, because there was this theory we would have a 2-week hiatus and then reassess, but essentially it's a 1 week, and we're going to be up and running on Monday. And my kids were certainly happy to hear that assessment is not part of the equation. But for the food the food assistance program, the eventuality exists that we may be in this for quite sometimes multiple weeks that stretch well close to the end of the school year. And I'm sure there are plans in place, but if there's a transition from your program to Kristen's program, that town leadership and us on the board can be prepared for that, to address it from not only a budgeting situation, but also from a logistical situation as well, if that does take place.
Right. Thanks.
That's a great point, Chris. And just one question, Neil. There, I've had some discussions, and there's been some articles around the needs of our special needs community.
Yeah.
And obviously, the traditional sending work home might not address those folks' needs. So, administration
Right.
still at work with plans for those kids.
Yeah, so that would be a communication that less of the population would have seen, but special ed families were contacted by Sue Lemke's office about how we are going to support those students as best we can remotely. It basically involves case managers and even paraprofessionals checking in with those families, but also working with the classroom teachers to help to modify work to the extent they can. But we definitely, it's not a burden only on the classroom teachers. All the other roles, including things like guidance counselors and social workers, will be reaching out to families and I don't think we can say exactly how it will look right now, but we certainly have been hard at work thinking about our special education students.
No, and I appreciate that. I knew you would be. I just wanted to make sure that we talked about that here because this town has always been a leader in that space. So I appreciate you looking after all the kids.
Neil, this is Kevin. Have you found any issues with people unable to get connected to internet providers?
Not yet. There's a part of our website. We did a survey, but it was an electronic survey. So, if you don't have internet access, I'm not sure you necessarily were able to take the survey. But right now, what we're going to do is be able to see who is engaging in the online learning as early as next week. And if we see students and families that are not engaging, we'll reach out. And I think that's probably how we'll learn if there are internet access issues.
Okay, certainly, if we can be of any assistance working with the utilities, certainly call on us.
Yeah, thank you.
Kevin, hey, Chris, just so you know, from a parent's perspective, obviously, it's a moot point. If you don't have internet, you're not going to get an email. But the email communications that come out have guidance in there for parents who are having or may be having trouble connecting to the portals. And there is a technical services area that's been, I believe, dedicated within the BOE for people to call into for assistance in that perspective. So they're trying to cover the bases. Obviously, it's a new world, but I have been impressed at this point with the level of communication and the efforts to get connectivity up and running and moving.
Yeah, I agree with that, Chris. We get the same notes here come in, the emails come into here also. But I just want to make sure, like you said, if they're not getting the emails for these updates because they don't have an internet service provider, is my concern, is that there is now an outlet that is going out to make sure these people are connected.
This is Kristen. I have a list that I received yesterday of internet providers that are providing either free or reduced rate internet, as well as waiving late fees and opening up hotspots. So if there's someone that you wanted me to share that with, I'd be happy to do so.
Thank you.
Excellent. Thank you.
You're welcome.
All right, other folks, are there other questions for Neil? All right, Chief, you want to talk on the police side, please?
Sure. Good morning, everyone. Just a real quick, first I want to thank Jennifer and her members at Farmington Valley Health District, because we have been on the phone with them and in connection with them multiple times every single day for at least a week now, providing some very important information. And then along those lines, the police department has been in contact with our regional colleagues in the area to figure out any potential staffing issues that may arise and how we're going to handle those. As of right now, staffing, we're doing pretty good. We have provided some modifications of services, which we have put out there to include online applications, some telephone reporting, which is very different than we have ever done, and then some strategies to help keep social distancing during our investigations, which will continue our interviews and our normal core services. The public may see less sort of self-initiated activity. Officers going out and just talking with people and stopping in at businesses. So we're just trying to practice that social distancing, but we want to make sure that the community is very aware that we are here and we are available for all the same services and anything else that may pop up. There is emergency access to the police department only. Those doors will still remain open, but we are encouraging everybody to call first. So that has been put out on social media. It's been put out in a press release. It is also marked on the doors of the town hall that we're recommending or encouraging people to call unless they have to walk in with an emergency. That's pretty much where we are right now.
Appreciate that, Chief. And just for Mr. Peterson, that doesn't mean that the speeding limits are to be exceeded at this point. So,
hopefully, as you drive around town, if you're out and about, you will certainly see the cruisers out there.
I'm on a bike now, Sean. On a bike.
There you go. Sorry, I got to add some levity and give my colleague a hard time here. All right, Chief, on the fire department.
Yes, good morning, everybody. We are, taking a number of measures. Certainly, first and foremost, we want to continue to protect our first responders. As everybody knows, these are a vital, core of our ability to service the community. As volunteers, in particular, these are people that are doing other things in daily lives, going to work and so forth. So the potential is certainly maybe at a greater risk for some of these people. So we are certainly encouraging social distancing. We have taken steps to reduce the amount of interaction even among the members themselves by canceling drills, doing a lot more in terms of remote, using technology for remote communications, be it Zoom or Microsoft Teams and things of that nature, to allow us to continue to communicate and interact, but in a appropriate social distance manner. We have changed some of our operating procedures. We have pretty much closed our buildings, if you will, to the public in terms of public access. However, we are still there for business. We're just asking people to, when they come to the main house, for example, to use our intercom system to communicate with our dispatcher, and then we will take the appropriate steps to address their needs. We have taken also some steps in terms of our operational for responses by doing pre-screening with phone calls that come in to allow us to determine if there is in fact a potential exposure risk, and also limiting the amount of personal contact with potential people who are looking for assistance from us. One of the things that we're also looking at is down the road, if we start to see an impact with other agencies who are starting to show or experiencing less ability to respond because of the size of the department that we do have of close to 100 people, we envision that we in fact may be put into service to do more in terms of support for EMS, support for other public safety type of situations. So we're trying to gear ourselves up in terms of better protection, in terms of equipment. That's some of the things that Kevin alluded to in terms of trying to get more resources in terms of personal protective equipment that we could use. The other thing that we have also done is we have been in touch with all of our surrounding communities. As you know, in the fire service, one of the things we do rely on is mutual aid in the event that we don't have adequate resources to handle an emergency. And we have been in touch with all of our surrounding communities who are doing very similar things as us to ensure that not only that we're prepared to assist if they need our help, but at the same time that they're also in a position to do the same, which will also include, again, social distancing, if we do have them coming in to help us, how we expect them to proceed so that we can maintain the levels of safety and exposure safety for those mutual aid companies. So we have a lot of things that are happening in that regard, and certainly we want to remind our residents, that, especially those that are home now, to be very safe in their day-to-day living. In terms of fire safety is still first and foremost, and we need to make sure that people are remaining that level of safety, and also to be very, very careful in regards to don't start to experiment at home with household chemicals in terms of trying to attempt to make cleaners or sanitizers or things of this nature. It's a very, very important message to our citizens, in the fact that we want to make sure that they don't create hazards unnecessarily that put themselves at risk, that put their families at risk, and then ultimately could put the first responders at risk as well.
An excellent point, Chief. Thank you for that reminder.
Not to be forgotten, of course, Karen, ambulance. Jeez, got my K's mixed up. Sorry, Karen.
Nope, no worries. Happy spring, everybody. I just want to assure the group here and our members in town that we currently are pretty well stockpiled with masks and any PPE equipment that we need for calls. We have found recently that the state actually has a stockpile of N95 masks that hopefully are going to be released to various services. I'm not quite sure how they're going to divvy that up, but they do have quite a bit stockpiled, I was told yesterday, which is good. One of the things I wanted to mention is I'm very concerned about the low call volume, so I want to inform town residents to not hesitate still to call 911 if they're having any issues, especially chest pain, diabetic issues, or even breathing problems, because we're still here for you, and I'm afraid that people are not wanting to call 911 because they're afraid they're going to get taken to the hospital and they're going to be exposed and cause other problems. So that was a concern. I'm not sure why the call volume's dropped off, but it's not just us. All the other services, even the commercial ambulances in Hartford, are seeing a huge drop-off of call volume. So not sure where that source is coming from. Just want to remind people we're still here. We're here for you. We're here to help. All of our paramedics are trained to advise you on whether you really need to go to the hospital or not, or whether you should follow up with your doctor or give it a couple days and you might feel better, that kind of information. So we're here to help in that capacity. In terms of our internal staffing, we have dropped our A2 program, which is the training program, so the volunteers are not going to be exposed on any calls at this point. We'll hopefully reinstate that once this is all over with. I do have ongoing conversations with the fire department and with PD to make sure we're all on the same page in terms of first responding to calls and what's appropriate, who should go in, who shouldn't go in the house, et cetera. And what else? I think that's pretty much it for us, but we're here and ready to go, but I guess we're waiting for the other shoe to drop at this point. Knock on wood, that doesn't happen. And any questions from anybody?
Can I ask a question to, and to Jennifer with regards to something said? This is Nancy again at the VNA. Obviously, Jennifer and I, we've been talking about personal protective equipment. Most of it's amazing to hear that the state has a stockpile of N95 masks, and yet most of the home health care agencies in the state of Connecticut do not have enough of them. Some have absolutely none. We have some, but in the event this does become much more of a health risk issue than it is, at least for active cases in the Farmington Valley. We emailed Kevin Wick yesterday because we're trying to figure out at least some of the healthcare providers' priority for when that stuff gets deployed out that is in Connecticut. Do you know, Jennifer or Maria, if there's some way that Eric or whomever, can reach out to make sure that the stuff that is in Connecticut can kind of get to some of, like, the first responders and or home care agencies? We're getting flooded with patients right now because they want to keep people in the community and out of the hospital in the event that hospital beds are needed. But at some point in time, a lot of us don't have necessary equipment, and we just need some help at figuring out how to get that.
This is Kevin. I can assure you that once we get those products and we have them in ample supply, we will make everyone aware of that. I agree with you. You guys should be on the forefront of getting that equipment also. So I don't think that it's an issue of whether we can give it to you or not. Once we get it, we will be getting that supply out as best we can.
Thank you so much. We really appreciate it.
Yeah, and this is Karen again. My understanding is that the stockpile the state has is actually technically expired N95, so they're just waiting for the CDC to say, yes, you can release them, we can still use them. I see no reason why these masks would expire at all, but because they're stamped with the date, they're waiting for some official ruling on that. And once that happens, then those should be released to various services in the state. And once I know more, I can let you know.
Thank you so much.
Government bureaucracy at its best, my friends. Yes, we gotta.
Has it been cleared up? Sean, this is Tom Roy. Is anybody aware if it's been cleared up the use of the N95 mask by staff without respiratory clearance?
Can you say that again?
We've had just the internal discussion as to whether or not, under normal circumstances, I believe if you're going to wear an N95 mask, you have to go through respiratory medical check. And there was some talk that was going to be waived. Has anybody found out if that's happened yet?
I've not heard that they've waived that. In the shortage of N95s, regular surgical masks used on a sick individual is the first line of protection for you, and then trying to keep distance. Obviously, that's difficult for emergency medical services. I've not heard anything about the waive of the N95 fit testing and medical clearance, but in critical situations, I would say something is better than nothing. I would defer to everybody's medical directors for guidance on that.
One of the issues as well is that you're not able to get the testing chemical that you need actually to do the N95 testing correctly. So I think that's maybe why it's going to be waived, because that's back ordered as well.
Although we do within the Farmington Valley have some resources through fire departments to do fit testing with the pressure monitor as opposed to the banana oil that's been used in the past.
But I agree, any mask is better than nothing.
All right. I believe we have Tom Roy. Anything related to the conversation to add?
Just we have our custodial staff is cleaning the buildings with a disinfectant sanitizer at least 2 times a day. We've set up stations so that all of the employees can clean and disinfect their own workstations, and we've made that available. The police have a separate station for cleaning and disinfecting any of the cruisers that if they come in contact with anybody. And we had been working on getting a debris monitoring / FEMA consultant on board. We've actually selected Tetra Tech, and this was something that had been going on for a few months. We actually have a conference call set up with them today at 1 o'clock, where we're just going to see how, as the FEMA experts, they may be able to help us with any logistics or any other preparation just from a national standpoint. So that one may be interesting. I don't know if Kevin or Mike Barry, if you want to get in on that call.
Certainly we can. Just send me the info on it, and we can jump onto that call.
Okay, we'll do. That's it.
All right. Other updates, other folks, questions surrounding the topic of the day? I heard a lot of good collaboration today. I heard a lot of good thoughts and questions. I'm going to suggest, and again, please feel free to shoot me down, that we schedule another one of these meetings in a week or two, just at least to have a check-in on the calendar. Again, if there's nothing to update, we can certainly go quickly and cancel. But given the level of collaboration I just heard, I think it might be a good idea to have another one of these. Other folks agree?
That sounds good. One thing I will add is, in the event that things get a little bit worse, as far as our response protocols needing to be met, we will actually open the EOC and to try to get some resolution. It won't be for all participants, but we will try to do what we can do, because I really don't want to get to that point. I'd like to do it all electronically. I really don't want to put us all in one room down in the police station. So that's what we'll be playing to see how everything evolves, and we'll get that information out to everyone.
Absolutely, yeah, and I don't want to be redundant, Kevin. I was assuming we were operating as is. Obviously, if things escalate, then this meeting will get out of the way. But as long as folks agree, again, not looking to meet for the sake of meeting, but you guys all have a lot of information. You're all going in a lot of different directions. A half an hour or an hour of collaboration might continue to help us move along. So, all right, I'm going to table the ordinance for wildlife and feeding as it doesn't seem relevant today. We can pick that up another time.
Sean,
Other contributions, other questions?
Yeah, Sean, it's Maria. Just real quick, in terms of a date, do you folks want to do 8 a.m. next Thursday morning, like a week from now, do a check-in, or would you prefer to do 2 weeks from now with a check-in for this larger group?
I'm fine with a week, given how fast this is all evolving, but I'll leave it to the experts.
This next Thursday?
Again, you're not going to hurt my feelings if folks don't want to do it for 2 weeks. I just think
Yeah.
Yeah, I mean, we can set that date. We certainly can post a date a lot earlier if the need arises.
Yeah, let's just put that on the calendar, and then again, we'll evolve as we need to. Again, not looking to meeting for the sake of meeting, but the collaboration I think has been outstanding this morning. So.
Okay, great. We'll send out a calendar invite for that.
Okay.
One final note for anyone that may be streaming live or watching us, just a reminder that the First Church of Christ is also partnering with Fitzgerald Foods right now to get delivery out to the seniors, the handicapped, and those populations that might have trouble with going into the store or afraid to go into the store.
Thank you, Sarah. Appreciate that. All right, folks. Thank you for all you're doing. I know everybody's going 150% right now. I appreciate it. So we'll everybody stay healthy, practice that social distancing, and we'll all get back together in a week or so.
Okay, great. Thank you.
You as well.
Thank you.
Thank you
very much.
Thank you very much. Appreciate it.